Hi, it's Kristin doing my head to toe. Just to give you a heads up, you might see a cat or two walk by. Don't think we'll see that in the hospital. But anyway, so the first thing I'm going to do is introduce myself. Hi, my name is Kristin. I'll be your student nurse today. Then I would perform hand hygiene, provide privacy by shutting the curtain or closing the door. I would make sure the table is locked and at the lowest position for the patient. And just to give you a little rundown, we're going to do a quick head-to-toe exam. Is that okay with you?
Yes.
Great. So just for general appearance, my patient looks, from what I can see here, symmetrical. Height and weight look within normal range. Patient is sitting relaxed with hands at side. So the first thing I'm going to do is ask you a couple of questions. Can you tell me your name and date of birth?
Michael DeMacy, 4/10/1990.
Great. And can you tell me where you are?
In my home. But a pretend office
And
or hospital.
what are we doing today?
Head to toe physical exam. Thanks for telling me before.
Can you tell me what you had for dinner last night?
What day is today? Thursday, last night was Wednesday.
I can't remember
we
either.
What did we have? I don't know. Well, we did have Wendy's at 11 o'clock last night, so
We did.
so that happened. But
Okay.
I don't remember what we had actually had for dinner.
Okay. Can you tell me what your first job was?
Worked at a skateboarding shop.
And do you know who the president is?
President Trump, I guess. Kind of, halfway.
For like 60 more days.
Something like that, yeah.
So my patient is awake, alert, aware of surroundings, and is oriented to person, place, time, and situation. So the first thing I would do is vitals. I don't have a cuff, but what I would do is palpate for the brachial artery, place the cuff about an inch or two higher, and then while palpating, I would pump until I can't feel the brachial anymore. From that point, I would note the number of mercury, I forgot what it's called. And then I would put my stethoscope, the diaphragm here, and pump up again, but adding 30 to that original number. And then I would slowly release the cuff. And the first sound that I hear would be the systolic, and the last sound would be the diastolic. Then I would do temperature, putting an oral thermometer under sublingually in the hot pocket, noting that the range should be between 96.4 and 99.1. Then I would palpate for radial, noting that it is 2+, counting for 30 seconds. And we'll just say that the rate is 70. But then I would stay here for another 30 seconds, watching respirations. And it doesn't look like he is unlabored breathing. Respirations look good. And I'm going to say 16. So then I'm going to work on the cranial nerve. So for cranial nerve 1, I forgot to get a little smelly thing. Can you close your eyes for me?
Mm-hmm.
You can smell that?
Yeah. Smells like hand sanitizer.
Yes, sorry, that wasn't that great. So cranial nerve 1 is good. Intact, the patient can smell. And normally for optic nerve 2, we would have a Snellen chart and have the patient stand 20 feet away. But we don't have that. And because my patient is under the age of 40, I'm not going to do a near vision test. So for now, what I'm going to do is just, I'm going to have you look at my nose, and I'm going to wiggle my fingers. You let me know when you can see the wiggling. Okay, good. Patient cranial nerve 2 intact. And then for cranial nerve 3, 4, and 6, I'm going to be checking for the extraocular muscles. So if you could just look at my finger and just follow my finger with just your eyes. Good. And so I'm making sure he's tracking evenly. And now just keep staring at My finger. Good. Patient is also able to accommodate and can do all cardinal movements. So then for 5, if you could close your jaw for me, kind of clench it a little bit. So I'm feeling for that TMJ. Everything seems bilaterally equal. Pressing on it, trying to open it, does not work, so motor function is good. And then for sensory, you could just close your eyes, tell me if you feel this.
Mm.
And this.
Mm-hmm.
Good. So sensory function intact. And then for facial, you can open your eyes now, sorry. If you could, please for me smile. And close your eyes. Puff out your cheeks. And frown.
I can't.
Good.
I can't.
So patient shows facial immobility. Cranial nerve 7 is intact. For cranial nerve 8, I have already noted mentally that my patient can hold a conversation, follow directive, and answer appropriately. So the only thing I would have to do is the whisper test. So I'm going to just whisper a couple things. If you could just repeat after me if you hear it.
Mm-hmm. 5W2.
Beautiful. For 9 and 10, we're going to do them together because it's hard to differentiate. So if you could for me swallow and open your mouth and say ah, stick out your tongue.
Ah.
Good. So uvula rises and is midline. And patient able to swallow. For 11, for spinal, I'm going to look at the delts and all the muscles in this area, and everything looks bilaterally equal. And I'm just going to place, wherever I place my hand, if you could just fight against it or push against it, so right here. Good. Patient able to shrug up and push against me. And again. Good. Movements are smooth. There's the cat I was talking about. Movements are smooth. 11 is intact. And for hypoglossal, if you could repeat after me, light, tight, dynamite.
Light, tight, dynamite.
And say ah.
Ah.
And stick out your tongue. Beautiful. So patient speaks clearly and effortlessly. I don't see any tremors, or don't hear any tremors, don't see any tremors. So 12 is good. So then we're going to move on to motor function, range of motion. So you could just stick your hands out like this. And anywhere you feel my hands, I just want you to push against it. Good. Good. And one more. Good. So upper extremities are good. And now for the lower, I think you'll be able to see this. So push against me. Good. Push against me. And step on the gas pedal. Great. And now for cerebellar functions, I'm going to, if you could just put your hands on your lap and do this for about 20 seconds, as fast, as smooth as you can. Great, so, Lily, we have people watching. So,
Very ladylike.
movements are smooth, quick, and effortless. And then I'm going to have you touch my index finger with yours and return to your nose about 3 times.
Sorry.
We'll give that a pass. And then the last for this part is if you could just take your heel and run it down each shin. Great. So patient is able to do that motion in a straight line and does not lose contact with his shin. So after that, we're going to go on a little adventure. I need you to take 10 steps forward.
Mm-hmm.
When you get to the 10 steps, if you could turn on your tippy toes and come back heel to toe.
Okay.
10 steps. You can just go that way, you don't have to stay in frame. Tippy toes, good job. And now heel to toe. Like the DUI line we see on cars. Great. And now while I have you up, I'm just gonna have you stand there, your hands at your side, and close your eyes. So we would normally do this for about 30 seconds, making sure he's not swaying, he's not losing his balance. This is what we call a Romberg test. Everything looks good. He passes. You can sit back down. So now to move on to HEENT, the first thing I'm going to do is inspect. And head looks symmetrical as normocephalic. Then I'm going to palpate, looking for lumps, bumps, lesions, none noted. I'm looking at the external eye structure. His eyes are bilaterally equal. Eyebrows are equal and the hair is equally distributed. Lashes are evenly dispersed, equal. If you could close again for me. Good. Upper lid able to approximate to lower lid. And now to check the anterior, just gonna do a little consensual and direct light. So first I'm gonna put it in his left eye, noting the left eye's constriction. Then I'm gonna do it again, but look at the right for indirect. So I'm just gonna, pupil constricts. Now I'm gonna look at the right. That one constricts as well. Iris, let's see. Iris is round, and I probably should have lowered the light for that, but I still saw it. Iris looks round. The iris also looks, the color looks evenly distributed. Corneas are pink. Sclera is white. Patient's eyes look dilated to about 4 millimeters equally, so we have positive perla. Pupils are round, reactive to light, and able to accommodate. The next thing I would do is look at the ear. So I'm looking for swelling and edema, discoloration, but I don't see anything. Everything I've seen thus far is skin is intact. And I'm just going to, you tell me if this is uncomfortable or tender. So I'm going to press on the tragus, pull up on the pinna. Any of that hurt?
Mm-hmm.
Great. So again, no thickening of the ear. Looking inside the external meatus, I don't see any foreign bodies. And just the last thing from the eyes, I don't see any swelling or redness. I don't see anything coming out of the lacrimal apparatus. Everything looks good. And then just looking at your throat, if you could just stand, sit up straight. So just looking at the throat, it is midline. This is when I would have the patient lay down and look for JVP, but he is young and healthy, and I don't think I'm going to see any bulging, but I would have him lay back, and I would assess this area for any pulsations. Then the next thing I'm going to do is the lymph nodes. So starting back here, I'm going to do occipital, post-auricular, pre-auricular, jugulo-digastric, submandibular, submental, interior cervical chain, posterior cervical, deep cervical, posterior cervical, and if you could just shrug like that for me. Good. Supraclavicular. Great. So now I'm going to have you lie back if you can, and we're going to do cardiac. Sorry. So the first thing I'm going to do is look for carotids. So I'm going to palpate. We have 2+, good. 2+. Carotids are bilaterally equal. Now I'm going to check for bruits with my bell. And no bruits are heard, which is what we want. The next thing I'm going to do is just inspect the precordium. So I'm looking at his chest and I don't see any heaves or lifts. Skin is intact. I'm going to feel for pulsations and I don't feel any. Skin is warm to touch and no areas of excessive dryness or excessive moisture. Then I would check for, I would auscultate for heart sounds. So the first one I'm going to do is take this out so I can hear myself. Apical. And that's going to be in the center and the second intercostal space on the right sternum border. And then pulmonic, Herb's point. Good. Tricuspid. And mitral, which should be by the 4th, 5th intercostal space. This is the mitral is the one we would do for a full minute, but I'm not going to do that because we only have 30 minutes, and I don't know if I can do it all in 30 minutes. Then the next thing I'm going to do is have you just kind of go over to lean to your left. I'm going to look for the apical pulse. I'm going to look for the 5th intercostal space, mid-clavicular. And if you could just hold your breath for me. Good. Apical pulse found, and it's like short, gentle taps. And while I'm here, while I have him down flat, I'm going to do the abdomen. So the first thing I'm going to do is inspect his abdomen. And skin looks intact. Abdomen looks bilaterally equal. I don't see any pulsations. I don't see any bulging, any protrusions. Umbilicus is hairy and midline. Don't see any hernias. I can't remember if I said that before. And the first thing we do for abdomen is auscultate. So I'm going to check all 4 quadrants. Just noting for vowel sounds, starting with the left lower, left upper, right upper, right lower. Okay, so vowel sounds found in all 4 quadrants. If I didn't hear one, I would listen for a full 5 minutes before stating that there were no vowel sounds. And then I'm just going to do some percussing in a circular pattern around his umbilicus. So let's see. So it's just middle finger over middle finger, dominant hand on top, noting tympany. Good. Tympany found, or tympany heard, I should say. Normal tympany. So now I'm going to move on to light palpation, which should be about 1 to 2 centimeters, so deep. So I'm just going to poke and prod a little bit. You let me know if it hurts. So with 3 or 4 fingers, I'm just going to go around in a circular motion, looking for tenderness, lumps, bumps, and that was good. So now I'm going to move on to deep, which is going to be about 5 to 8 centimeters down, which is a little uncomfortable. Good. Okay. And while we're here, I'm just going to palpate for the femoral. So if you don't mind, may I? Okay. Well, I don't.
Yeah, no, fair enough.
So I'm just going to palpate here, right at the top of the leg. And we have 2+. I'm going to go around to the other side because symmetry is key. Good. Femoral is 2+ and bilaterally equal. Next thing we're going to do is respiratory. So if you could sit up for me. I wonder if it's possible to maybe turn a little that way, just so they don't think I'm making it up behind you. Great. So the first thing I'm going to do is take a peek at the posterior thoracic cage, and it looks bilaterally equal. Spine is in a straight line, midline. Hair is evenly distributed down this way. And now so then the first thing I'm going to do is test for tactile ephemeris, and you're going to feel my hands in about 5 different spots on your back. When you feel them, I just need you to say 99 for me.
Okay.
Good? All right, are you yawning?
Yeah.
Okay, I'll wait for you to stop.
No, I'm good.
Okay.
99. 99. 99. 99. 99.
Good. So vibrations are equal on both sides, and it kind of diminished as I went down, which is what we're looking for. The next thing I'm going to do is percuss. So in those same spots, I'm just going to go in a Z-like pattern, looking for resonance. Good. So resonance heard, no abnormal sounds found. The next thing I'm going to do is auscultate respirations. So every time you feel my stethoscope after I clean it, so every time you feel this land on your back, you could just take a deep breath in through your mouth. Okay. Good. And again. Good. And again. Great. So breathing is normal, unlabored, and normal breath sounds heard. No adventitious sounds found. So now I'm going to have you, if you don't mind, face me, and we're going to do some sensory stuff. I'm going to have you close your eyes, and you tell me if what you feel is dull or sharp.
Sharp, maybe.
That was a dull one. Oh, I guess I didn't do that one right. Okay. Was that dull or sharp?
I feel like that was dull.
That is dull. Dull or sharp? Light or sharp?
Light.
Great. So patient is able to identify light, sharp, and dull. I forgot to bring something. Okay, close your eyes. I'm going to put something in your hand and you tell me if you can identify it.
Q-tip.
Yep.
It's
Great.
been eaten up by a cat.
No, I had it here for the light touch thing.
Oh.
Give me your hand, please. Turn it around. Close your eyes. I'm going to do a little drawing on your hand. You tell me if you can recognize it.
I think that was an R.
It was a K, but that was kind of...
One more time. An upside down H? What?
No,
Do
it's
that
an
one more
N,
time.
Michael. How about this one?
That's a B.
That is a B. Okay,
Definitely
so
say
N
that.
was a tricky one because you have to go over it twice. Patient, I'm sorry, I just tested for stereogenosis and graphesthesia. Patient kind of okay with identifying them, but we'll let it slide.
Yeah, that scares me. Anyway.
So now to go on to skin and vascular, every area that I've been assessing, I have been noting for skin tone, and his skin looks fair throughout. It's evenly toned. Complexion is even. Hair is equally distributed. Abdomen is flat. I forgot to mention that before when we were sitting down. So now I'm just going to inspect your arms, looking for any lesions, any bumps, any edema, any breaks in the skin. Oh, you're cold. Again with this side. So arms are equal, hair is evenly distributed. Same for the, again, just feeling for edema. I don't see any pitting. Great. And may I see your hands, please? Good. So nails are smooth, not clubbed. I'm going to do a cap refill here. Great. And this one? Good. So they snap back in less than 2 seconds. I'm going to do the toes. Cap refill is good. Good. Now I'm going to do pulses. So I've already done the carotid. I've done the brachial, but I didn't do both. All right. So we have 2 plus equal. Down to radial. 2 plus equal. Popliteal. 2 plus. 2 plus equal. Okay. Posterior tibial. 2 plus. And dorsalis pedis. 2 plus and equal. If you want to just, great. So I think I've touched on everything. The last thing I would do is obviously document and chart all of my findings. And now that I've finished, I'm just gonna take a quick walk around the room just so you see I don't have any cheat sheets. I'm sure you'll know that because I'm sure I missed something. Hope everything is in shot. Let me just do a walk around over here. Nothing. A quick shot of the ceiling. Nothing. And just a quick thing of the floor. What are you doing?
I'm making it easy for you to show what this room is.
And then that's Molly. Hi, Mo. Bye, Mo. All right, that's it. Thank you.